Hey everyone, thank you for joining us. Get your questions ready. We are live doing a Q&A session here with myself, Dr. Deigni. I am a board certified plastic surgeon. I practice in Houston, Texas. This is our phone number. You can text us or call us during business hours. You can text us anytime. We'll respond during business hours. And looking forward to getting to meet you guys either virtually for your consultation or in person, and then taking care of you as well. So let us know where you're joining us from. Get your questions ready and start us off. We're talking about body contouring procedures, including the drainless tummy tuck, which is my signature procedure. I have some before and after pictures posted right there. When I do the tummy tuck and all of these body contouring procedures, I don't use drains. There's no need to use drains. I use a special technique that allows you to have a much easier and smoother recovery. And you're not bogged down by the drains pulling on you, tugging on you, having to empty them and coming back to the office 2 to 3 weeks later on to get them removed. So definitely the game changer in this space is being able to do these procedures without having drains, and it makes your recovery a lot smoother. Please go ahead and share the link with your friends. Let them know that we are live so that they can also participate and ask questions, and everybody can enjoy and benefit, as well as put in your information in the bottom left of the screen there. There should be a form where you can put your name, phone number, email, and let us know what procedures you're interested in having done. And we'll be happy to get you guys on the books for your consultations and for your surgeries. All right. I'm going to go ahead and answer some questions that you guys have sent over the last couple of days. Okay, we've got Tiana49, who is starting us off with how much and where, please. We are located in Houston, Texas. Right here is our phone number. For the drainless tummy tuck, on average, is around $13,000, and it includes anesthesia, facility, and surgeon's fees, as well as all your post-op appointments, your garments, and your scar cream. So definitely contact us, put in your information in the bottom left of the screen there, or just text us or call us at this number, and we will get you on the books for your consultation and your procedures. So some of the questions that I've written down that you guys have asked, one of them is, do you do virtual consultations? Absolutely. We do virtual consultations. We get a lot of patients that come in from out of town, out of state, and a few from out of the country. And so we start the whole process with a virtual consultation. So you will put in your information in your medical portal, fill out your medical form, tell us about your allergies, medical history, surgical history, and all that. And thank you very much for the roses there. I am Queen the Minister. I appreciate that. And then we'll get you in for your surgeries. How much is a BBL and a thigh lift, please? Great question. I don't have the answer to that question, but definitely contact us. Shoot us a text with your name and that same question. My patient coordinator will be able to respond to you during this week, during business hours, and we'll give you an estimate. Or better yet, just give us a call. We'll be happy to discuss in further detail and give you an estimate so that you have an idea of how much you can budget for these procedures. The only one I know about is the drainless tummy tuck, because I do it so much, and it's on average $13,000 for the drainless tummy tuck. Kimberly Singleton, Singleton 575. I had a vertical C-section and one tummy tuck. Can it be done if I may have scar tissue? Absolutely, it can definitely be done. I've had multiple patients who've come in who've had the vertical C-section. And I've been able to remove that scar tissue. It takes a little bit more time. Got to be a little bit more careful and tedious, but Was able to remove that scar, give him a nice, beautiful, low-rising scar, kind of like for this patient, and very nice transformation to their belly. They're very, very happy and very pleased. So definitely give us a call or a text message, or put in your information in the bottom left of the screen there. We will reach out to you, get a little bit more information, and answer all your questions and get you in for your consultations. Thank you for participating. I appreciate it. Oh, JMJ is saying, hi, I want a BBL, but my BMI is 25. I'm 5'3" and 135 pounds. Should I gain weight first and then consider BBL? It all depends on how much of a difference you want and what your body looks like. For a BMI of 25, we would do what is called a skinny BBL. So it's a combination of doing the liposuction to remove excess fat in certain areas that will give you that contour, and then we augment the other areas, so like your hip dips or butt area, with the fat that we're able to harvest. That together gives you a very nice contour. So I would say come in for your consultation. Let me be able to examine you, and then we'll see where those areas of fat lie, and how much fat we feel we can get, and how big of a transformation you'd like to have done. And we can move forward from there. Great question. Emma Higgins is saying, I'm interested. Wonderful. By all means, put in your information in the bottom left of the screen there. There should be a form that you can fill out. Let us know what procedures you're wanting to have done. We will reach out to you later this week. You can also put this number in your phone, text us, call us, and we will get back to you as well. Great question by Am Queen, the minister. Yes. So asking, can I do installment payments before surgery? Yes, you can. I've had some patients who do that. So you can make some payments. So we definitely want to make sure that 2 weeks, at the latest 2 weeks before surgery, all payment has been received, and we can move forward with your surgery. Of course, we will have booked your procedure well before then, because it does book in advance. And we want to make sure that you keep that spot that you're wanting to have. We also offer financing options. We offer Patient Fi, Care Credit, Alpheon, and charity financing. So definitely contact us, and we will be happy to give you more information, discuss further, get you on the books for your surgery, and look forward to taking care of you. Happy Flower, I'm ready to go, but I haven't reached the minimum BMI. Very, very glad to hear. Mentally, you've prepared. That's great. We need to get you to hit that minimum BMI of 35. It is for your benefit and for you to be able to hopefully maintain those results longer term. Definitely want you to get that BMI of 35 as a max BMI. So keep working on it. You will definitely be welcome. We're looking forward to taking care of you. And thank you for following us and participating. Much appreciated. Miss Ferry 96. Can I do a BBL? Can I do a BBL if I want to have babies in the future? Yes, you can. If you want to have BBLs in the future, thank you very much for the roses there. I appreciate that. And thank you for your questions and participation. We look forward to taking care of you. So Miss Ferry 96, if you want to have babies, it depends on how soon you want to have babies. If you know you're going to have babies maybe in 3 to 5 years, yes, you can have a BBL now. Nothing will stop you from getting that. The only thing is when you do have babies, you may need some more surgery after you're done having babies, because they'll most likely change the results. That's all. But it shouldn't limit you from having babies, especially if you want to have it done soon, and then you're not planning on having a family maybe in the next couple of years. Hey, LaWanda Wilson, how you doing? Thank you. Okay, I'm Queen, the minister, is asking, do we pay for a consultation? Very good question. Yes. To book your appointment is $150. You will be meeting with me, board certified plastic surgeon, and that $150 will go towards your surgery when you book your surgery with us. Yes, thank you, LaWanda Wilson. Definitely, I totally agree. She's letting Emma Higgins know that it is totally worth it. Absolutely. That sounds great. Thank you. You're very welcome, JMJ. Looking forward to taking care of you. All right. Jess Sanchez 974. If I wanted a mommy makeover awake. Okay, so a mommy makeover awake will most likely not be possible. So if you want to get, like, for example, a mini tummy tuck, we can do that with you awake. It's a small enough area that we can dissect and actually make you comfortable enough with the local anesthetics to treat that area well. But a full mommy makeover, say for example, lipo 360, a breast lift, maybe some fat transfer to the breasts, fat transfer to the hip dips and the butt area, and a drainless tummy tuck and a monsplasty, that will be too much surgery to do with you awake. We will reach the critical level of local anesthesia that will be dangerous if we go beyond that. And so we won't be able to do all the procedures in once. So I wouldn't recommend doing a full mommy makeover with you awake. It won't be possible in one setting. If you want to do small procedures with you awake, we could probably do some of those. Otherwise, I would highly recommend doing it on general anesthesia like I do with all my patients and be able to get all of that done in one go. Annie Alvarez, where are you located? We are in Houston, Texas. This is our phone number. Go ahead and put it in your phone, text us, and or call us, and we will reach out to you and take care of you. Sue Renee, hello. Hello, Doc. Hi, Doc. One of these days, I will make it on your table. Looking forward to it. Looking forward to taking care of you. I appreciate it. And thank you, everybody, for participating and for following us. I really appreciate the support and for also sharing with other friends. And word of mouth is very powerful. So we always appreciate people coming in for their procedures, and they tell us who referred them. So I was happy to hear that. Butterfly, have you heard of not doing any blood work before a mommy makeover? Absolutely not. If anybody is offering you to do a mommy makeover without doing any blood work or any type of medical workup, I would run away from that place, because that is not appropriate, and it's not it is not doing you any service. You have to get the appropriate workup to make sure that everything is going well. With the minimum, at least a minimum lab work is important. We need to know whether you have anemia, if your kidneys are working well, your other organs are doing well. All of that is very important. Otherwise, you may have some serious side effects and adverse outcomes if you undergo general anesthesia and things have not been set right. Good night, sexy girl. Thank you for joining us. Wonderful. Ask your questions. I'm Queen of Minister. Is the consultation free, please? No, the consultation is not free. It's $150 for you to book your appointment, and that will go towards your surgery when you book your surgery with us. Exactly. LaWanda Wilson, exactly. Don't skip the blood work. It's very important. Exactly. So we definitely want to make sure that we cross our T's and dot our I's. Again, if you go somewhere where they say they don't do any blood work and they're going to do a full mommy makeover on you, that is not standard practice. I would not undergo that procedure. Now, if you're doing something on local, say for example, an earlobe repair or maybe a breast implant exchange under local anesthesia, small areas that need to be operated on, yes, you don't need a full lab work for that. But anything like a tummy tuck, a full tummy tuck, a combination of multiple procedures, you should get at a minimum some blood work. Haja, I'm new here. Welcome. Thank you for joining us. We are discussing body contouring procedures. I'm a board certified plastic surgeon, and I practice in Houston, Texas. This is our phone number, so you can put it in your phone, call us or text us, and we will reach out to you and answer during business hours during the week. And we look forward to meeting you either in person or virtually if you are out of state or out of the city and not able to come in person in Houston for your consultation. But we will start the process with a virtual consultation and then get you on the books and then get you to have your surgery. Butterfly, do some surgeons not require blood work to be done? Like I said, I would be very, very careful if somebody is offering you a full mommy makeover and is not doing appropriate blood work. That is not standard of practice and could be very, very devastating. Lil Missy Prissy, I have Addison's and Hashimoto's. Can I do a belt lipectomy? My BMI is 25. I'd have to look a little bit more in Addison's. It's been a while since I've been in medical school, so I don't remember exactly what Addison's disorder is, but I have to look into it a little bit more. As far as Hashimoto's, for both Addison's and Hashimoto's, we just need to make sure that we get medical clearance from your treating physicians and make sure that your condition is stable. And then we can move forward with surgery. So definitely come in and see us. Let's go ahead and get the process started, and we'll be happy to take care of you. J Dub, had a gastric sleeve surgery, and my insurance won't help with skin reduction. It's causing problems. Yes, so it is quite common that insurance won't cover these types of procedures. These are mostly considered elective procedures, so insurance won't cover them. You'll have to pay out of pocket. All of my patients pay out of pocket. I don't take insurance, but it's a huge improvement in their quality of life, especially if you have hygiene problems. You get body odors, you get cracks in your skin, you get wounds. And I had a patient, she came in and she was saying that she had used deodorant underneath her belly and in her groin area, in addition to using it around her armpits because of the smell that she would have. And so it's a little bit embarrassing, but now that we've done the surgery, she doesn't have to do that anymore. So definitely consider coming in for us to see you. We'll be happy to take care of you. If you're not in the Houston area, we can start with the virtual consultation. So, okay, so some people are talking about how are they coding the procedure. Yes, coding it definitely will matter. But again, I don't take insurance, so I wouldn't know how to code to try to get your insurance to pay for it. But some insurances don't cover these procedures, unfortunately. But we take care of all patients. Like I said, we offer financing options for them for these procedures: Patient Fi, Cherry Financing, Care Credit, and Alpheon. And like I said, we don't take insurance. All our patients pay out of pocket. And they're very, very, very pleased with the results. Lil Missy Prissy, and what is the cost to remove 15 pounds? Oh, so for liposuction, so I don't know what the cost is, but you'll have to just come in, call us, contact us. We need a little bit more information, and we'll be able to give you like an estimate. Most of these procedures will probably start around $10,000. The mommy makeovers are a little bit more, around $20,000 to maybe $30,000, depending on all the procedures that we actually put together. Usually these bigger procedures will be around 6-7 hours of surgery, and it's a full body transformation. So you come out completely transformed, flat belly procedure. Procedures can be added as well. And so a lot of stuff can be done. Hey, Tropical Exotic Treats, looking forward to you hitting that number so you can come in for your surgery. I'm sure it's going to be coming up soon. Fario Hassan 603 is asking, where do you base? So where am I based? We're based in Houston, Texas. This is our phone number, 281-724-3138. Put it in your phone and text us or call us, and we will reach out to you during business hours. Also, the easier thing is, since you're on the TikTok app, just put in your information in the bottom left of the screen there. There should be a form, and we will be happy to reach out to you, give you more information, answer all your questions, and get you in for your consultation and your surgeries. Lisa, I am interested in Lipo 360. Wonderful. We'll be happy to take care of you. Lipo 360 is a procedure that I do on quite a number of patients, and usually they'll combine that with other procedures like some fat transfer either to the breasts or the hip, dips, and butt area. Some other patients will want to have transferred to the back of their hands to rejuvenate the hands. Some patients will probably put it in their face as well to rejuvenate the face. And some patients will want it in their labia to rejuvenate their intimate parts. So there's plenty of options that we can do with that fat once we remove it through liposuction. We can discuss that in greater detail during your consultation and see what other procedures you might be interested in and can benefit from. Bignon Johnson, 43. How much for the drainless tummy tuck? On average, it's $13,000, and that includes your anesthesia fee, facility fee, surgeon's fees, all of your post-op appointments, and your scar cream, as well as your garments. Contact us. We'll be happy to get you in for your consultation and get you on the books for your surgeries. Sally is asking, how much is your mini and full tummy tuck? The full tummy tuck is $13,000. Like I was saying, it includes anesthesia fees, facility fees, and surgeon's fees, as well as all the garments. As far as the mini tummy tuck, I don't know how much it is. You'll have to contact us, and my patient coordinator will be able to get you an estimate for that as well. We definitely would want to get, thank you very much. I really appreciate the gifts there. Very, very appreciated there. Looking forward to taking care of you, like I said. So we have reached the goal for the gifts. Thank you. So definitely reach out to us. We will be happy to give you an estimate for the mini tummy tuck, but it all depends on whether or not you're a candidate for that. Not everybody will be a candidate for a mini tummy tuck. You might actually benefit from the full tummy tuck. The mini tummy tuck, in most patients, I can do it under local anesthesia with you awake in the office. Again, you have to be, it's a certain type of patient that can withstand that. So make it comfortable. You don't feel anything, but there's some people that even if they're comfortable, they still are very anxious and just are very apprehensive of seeing a needle or seeing anything being done on them with them awake. If that's the case, then you're not really an ideal patient to do surgery with you awake. Other patients, they are perfectly fine, don't stress, are comfortable. Once I numb them up, they don't feel things. Some of them actually fall asleep. And which is good. That means the anesthesia is working. The local anesthesia is working very well. Tasha, how do I know if I will need a tummy tuck after lipo 360 and the BBL? So it all depends on the physical examination. When you come in for your consultation, we're able to examine you and assess the quality of your skin, see how much fat you have, what's going to be removed, and then also during that exam, I'm able to actually have some idea of whether or not you will benefit from the tummy tuck to do with your lipo 360 BBL or not. So physical examination is very important. Wow, okay. Jesse James, my surgeon did not do my blood work until 2 days before my surgery. PTI and are abnormal. That's very late in the game. Unless you're really just start healthy, yes, you want to do the blood work at least 2 through 3 weeks before so that you can catch anything. And it also gives you some time to fix things if there are some abnormalities. Some abnormalities will take much longer to fix. So for example, this Friday, I have 2 tummy tucks that I'm doing back to back on that day. One of my patients, she came to see us, had a consultation. We did the lab work. She wanted to have surgery probably a month or so, within 6 weeks after the consultation. We did the lab work, and her hemoglobin was too low. She was anemic. She knew she was anemic, but she forgot. A lot of people forget, I guess. And when it came time to look at the results, we're probably a month before her surgery or something. I said, we cannot proceed. We need to get your hemoglobin higher. And so 3 months later, she was able to actually get her hemoglobin where it's normal. It's very good now, and she's on the books for her surgery this Friday. So some labs you have to treat absolutely, and it will take longer to get that taken care of versus something else where you have maybe some dehydration and we just need to, get you make sure that you're well hydrated and things are fine. Chucky Chucky Doll. What do you think of hyaluronic acid fillers? Is that safe? Hyaluronic acid fillers are safe. They mimic the structure of hyaluronic acid that we have in our body. So they're safe. It's just the injector. You have to make sure that you go to somebody who is qualified, who knows what they're doing, so that they inject in a safe manner and are able to give you some very nice results. Tina R. Hi, Dr. D. Funny to see you this way again. Well, thank you very much for joining us. Always a pleasure to see you guys on TikTok. I wish I knew before I paid surgery and it's non-refundable. Jesse James. Well, sorry about that. Again, if you need any revisions or any further surgery in the future, by all means, come and see us. We will be happy to take care of you. I've had some patients who've had surgery before who have wanted to get, by other surgeons who wanted to get revisions and also other types of surgeries. And we're always happy to get them to come in so we can take care of them. G. Haja Hafsat costs. Good night, doctor. Please, what kind of disease are not allowed for the BBL? Okay, so things that would make you not be qualified for BBL. Uncontrolled medical conditions like uncontrolled high blood pressure, uncontrolled diabetes, anemia. So if your hemoglobin is 9 or less, actually 10 or less, you shouldn't proceed with a BBL. If you're smoking, you have to absolutely quit smoking. Any kind of heart disease. So if you've had a heart attack or you have some type of a heart problem, we need to make sure that that's well controlled before you undergo this procedure. If you have kidney problems, there's a lot of fluid shifts when we do the BBL. And if you have kidney problems, you may not be able to actually process the fluid well. And so that will be disastrous. So those are types of medical problems that would make you not be a candidate for the BBL. Great questions. Oh, definitely. If you have congestive heart failure, you're not a candidate for this. Mami Wata is asking. Yeah, so congestive heart failure will disqualify you from having BBL and many of these big procedures. Good evening, everyone. Oh, okay. Thank you very much, Tropical Exotic. I'm just not seeing your comments. Yes, very good. You were able to get through. Looking forward to it. I know you've been following us for quite some time. I'm looking forward to taking care of you. We've had quite a number of you guys who have followed us on TikTok. We've been following us for a year or year and a half, some even 2 years, and you've come in, you've had your procedures. I've posted your pictures, you've commented on them. So it's really nice to develop that family. And it's nice to see you guys coming back for even more procedures. I've had some patients come in for their second stage, and some of them are also scheduled in the future for a third stage. So it all depends on all that you need to get done. Pretty girl, what's the price just for the tummy tuck? So for the tummy tuck, the price is on average $13,000. It kind of varies based on what surgeries you've had before, how much scar tissue you have, but on the average, it's around $13,000. That includes facility fee, surgeon's fee, and anesthesia fees. And I do the drainage technique, which allows you to have a much easier and smoother recovery. So it's a game changer. Most patients usually with the traditional tummy tuck will have drains in, and it'll take about 2 to 3 weeks to get those drains out. And it's a little bit of a cumbersome recovery. Whereas with my technique, you're able to go back to work usually within 7 to 10 days from the surgery. And it is amazing. It makes your recovery a lot smoother and faster. I also use Exparel medication, which is a long-lasting pain medication that I inject in your belly area, especially when I do the repair of muscle separation. And that helps you to recover a lot easier. Not to mention, my patients typically will be able to walk upright within 2 to 3 days after surgery. They don't need to be hunched over for 2 to 3 weeks. So all of that makes you a lot more comfortable. You focus on getting back to light activity, washing, cleaning yourself, eating, getting back to your daily living activities, and it's a game changer. It's wonderful. Gen X jewelry. Do you do paniculectomies? I do. It's not typically the procedure a procedure that I do quite often because most insurances will cover paniculectomies. We don't take insurance, so most patients will go to a doctor that's in their plan, their insurance plan, and is covered. I've had some patients who absolutely wanted me to do it, and they came in, they paid out of pocket, and I did their paniculectomy. They're extremely happy with the results because they know I do the drainage technique. It makes their recovery a lot easier, a lot smoother. And it was a price that they wanted to pay, and they wanted me to be their surgeon. And they were happy to pay out of pocket, which is fantastic. So, but I'm happy to do the paniculectomy if you want me to be your surgeon, absolutely. We do offer financing options as well for our patients, and we'll be happy to take care of you. Spanish, Mammy, 88. BMI requirements, and what if I had previous PE from 15 years ago, but no reasoning, but I'm fine now? Okay, I've operated on patients who've had previous blood clots and PEs, and we've done a workup, and they were extremely, they were fine. I operated on them; they did very well. So you should be okay. BMI requirements: max BMI is 35. Ideally, I would like for you to be 32 or less. All of this is to actually be able to get you to a healthier lifestyle and be able to maintain your results long term. It also decreases your risk of complications and wound healing problems and things like that. So all of this is for a specific purpose, not just to put barriers. It's to actually make your results last much longer, so you don't have to come back for revisions and things like that, because it does change as you lose the weight. But definitely contact us. There should be a form on the bottom left of the screen there. Put in your information and we will reach out to you. You can also register this number in your phone. Text us, call us anytime, and we will reach out to you, okay? Chrissy B, 1005. What is your BMI limit? So max BMI is 35. Ideally, I would like for you to be 32 or less. If you can get to a BMI of 30, 28 to 30, that's even better. I feel like that's the sweet spot to be able to do all of these mommy makeover procedures, get you the fat transfer, the skin excision, the tummy tuck and everything. And for you to actually be able to get those results, look really nice and keep them long term. If you're to get them when your BMI is 35, for example, and you're still on your weight loss journey, you're going to lose maybe 20, 30 pounds, you may need a revision down the road a couple of years later because of the loose skin that you will develop with those body transformations. So we're trying to get you as close to your ideal weight as possible to minimize the amount of surgeries that you'll need. Jesse is asking, can I get lipo and a tummy tuck? Absolutely. I do that quite often on patients. You can also even get fat transfer once we remove that lipo, once we remove that fat through liposuction. But you can absolutely combine liposuction and a tummy tuck. I do that quite often for my patients as well. Yeah. Monica Moreno is asking, how much is it? So for the drainless tummy tuck, on average, it's $13,000. That includes anesthesia, surgeon's fees, facility fees. It includes all of your post-op appointments with me. It includes your garments as well as your scar cream. I compound the scar cream at the pharmacy, and we ship it to you. It's nothing that you can buy over the counter. It's actually medical grade specific components that I asked the pharmacist to put in for your body, and all our patients love it. And all of that is included in the procedure, in the price. Ed, what is normal? I'm not sure what you're talking about. It probably was on one of the discussions or the explanation I was saying. Let me know what you mean by what is normal. Maybe like the hemoglobin. Hemoglobin, you should be at least at a between 12.5 to 15. I think that's the normal range. But I'm not sure what exactly you're referring to. Just let us know. Linda's psychic sessions. How much is a tummy tuck without muscle work, just hip to hip? It's the same price. I don't charge extra for the muscle repair. 99.9% of my patients who undergo a tummy tuck need the muscle repair. So I just include it. I measure it, include it, fix it. It's not a problem. So it's the same price, $13,000 for the surgery hip to hip for the tummy tuck. Very, very, the only time I guess I didn't do a muscle repair is because the patient had a previous tummy tuck before and I was doing a revision first. So she already had the muscle separation fixed. Otherwise, 99.9% of patients will need their muscle separation fixed. Miss Pretty Boss, I just had a tummy tuck with muscle repair. How long should I wait to do my Lipo 360 with BBL? Oh, okay. I will typically have my patients wait about 9 months. We want to make sure that you heal completely. The minimum, the fastest turnaround time will be 9 months. So we'll be happy to have you come in and see us. If you just had it now, I would say probably come to see us in about 6 months. At that point, you'll be very well advanced in your recovery. You still have some more recovery to go on, so that's why we definitely want to get you to that 9-month mark. And we'll be happy to do the Lipo 360 and BBL for you. Put in your information in the bottom left of the screen. We will reach out to you and answer any other questions that you might have. You're very welcome, Gen X Julie. Thank you very much for asking your questions. I appreciate your participation. Again, share the link with your friends. Let them know that we are live here. I'm a board-certified plastic surgeon. I know there's a lot of misinformation on social media, on the internet and stuff like that. So it may be very difficult for you guys to weed out through the information, trying to figure out what is the best way to go about this. You've got direct access to me. I'm the one who does these procedures. I'm the board-certified plastic surgeon. I've been doing this in my private practice now for 5 years, but I've been out of training for about 9 years now, and I've been practicing. Before that, I was practicing with other surgeons, and now I'm by myself and enjoying it. I love it. Gen X Julie, do you do apron removal or paniculectomy? I do. Yes, I do. So for some patients who are not quite there yet where they want to get to the full tummy tuck, I can do the apron removal or the paniculectomy. And I'll do the drainage technique, which makes your recovery a lot easier and a lot smoother. Again, like I was saying earlier on, another person asked about that. Most of the patients will have their paniculectomy or apron removal covered by insurance. I don't take insurance, so patients who come to see me, they want me to be their surgeon. They know that they'll pay out of pocket, and they're fine with that. And I do it drainless, and they heal extremely well. Val, Expra is included or is it optional? It's not optional. It's included. The way I do my procedures is to make your recovery as smooth and easy as possible so that you can enjoy the experience. You'll get pain medication, muscle relaxant, anti-nausea medication. You also get some anti-inflammatories. I inject the Expra medication to actually be able to really decrease that pain level to where you shouldn't be having more than a 3 or 4 out of 10 pain level, which is kind of like you're a little bit sore here and there. When you move, you're like, oh, okay, I had surgery. That's where I want your pain level to be. I want you to be comfortable. If you're not there and it's too high, we have to fix it. And there's plenty of ways that we can get you to get that pain level down. Like I said, the majority of my patients will wean off the pain meds usually within 3 to 5 days. They're walking upright within that same amount of time. They're usually driving themselves back to see me in a week after surgery. They're off their pain meds, and then after that, they're able to start going back to work. It is a fast and quick recovery. And I operate on patients in their 40s, 50s, 60s, and even in their 70s. And they have all, on average, done extremely well and had very fast recoveries like that. That's kind of like standard with the procedures that I do. So it's fantastic. A lot of people definitely come in for us because of the fast recovery and the drainage tummy tuck technique. And there are not that many surgeons in the US that do it. So definitely come and see us. We'll be happy to take care of you. User Princess 4200. I wish you were in Illinois. We have patients that fly in all the time. They come in from all over the place. So if you're wanting to have surgery with us, by all means, contact us. We will start with a virtual consultation and then make sure that all the logistics are in place for you to fly in, get your surgery, and then head back to Illinois. We'll be happy to take care of you. It's well worth your investment. Like I said, a lot of patients also here on TikTok are from all over the U.S. Plenty of patients that come in from Georgia, Florida, Northeast, New York, California, Oklahoma, the Midwest as well, and all parts of Texas, because Texas is a huge state. You can drive for 15 hours and you'll still be in Texas. Well, I might be exaggerating. Maybe 8 to 10 hours and you'll still be in Texas. Carla, if I already did a tummy tuck, but they didn't do the muscle repair, is it possible to still go back for that? Yes, you can. You can. Essentially, we'll be redoing your tummy tuck because we have to re-elevate everything and then fix the separation of muscles and then put everything back down. Definitely, it can be done. Especially if you feel like you have some bulging and separation of that muscle, and it's kind of like bothering you. Yes, then we'll go back in and fix it. All right, thank you guys for your patience. I'm just going through all of this to make sure that I'm not missing any comments. If I missed your question, please go ahead and post again and ask again. You're very welcome, Pretty Girl. You're very welcome, Gen X Jewelry. Thank you very much for participating. I appreciate that. Let's see. I am back to that question. Excellent. Thank you. Tina R says, you have an absolute fair pricing. Thank you very much. And remember, my techniques are well advanced compared to the standard techniques with the drains. So I appreciate you mentioning that my pricing is fair. Thank you. I've had some people come in and see us for consultations, and they've had consultations with other surgeons, and they said that for their tummy tuck, they were quoted $18,000 or $20,000 with drains. They don't even do the drainage technique. So we're always happy to be able to take care of our patients, like you said, at the fair pricing. No doubt that the pricing will increase in time, but for now, we're happy with that pricing. I know patients are extremely pleased with the results and the recovery process, so that's good. Nadar Bashir, how much do you charge? Oh yeah, so same, $13,000 on average is what I charge for my drainage tummy tuck technique, and that includes facility fees, anesthesia fees, and surgeon's fees, as well as all your post-op appointments and follow-ups. I do follow-ups with all of my patients over 6 months, so you get 5 follow-up appointments with me during that time. And you also get your garments and your post-op kit with the scar cream as well. User long number. Do I qualify for a tummy tuck if I have controlled blood pressure? Yes, you would. I've operated on many patients who have high blood pressure that is controlled with medication. Absolutely. So put in your information. We'll be happy to take care of you. Remember this number, or just not remember, I guess. We don't remember numbers anymore, but put this number in your phone, text us or call us anytime, and we will guide you through the process and get you in for your consultation. If you're out of town, out of state, even out of the country, we'll start with a virtual consultation, and then we will do all of the planning to book your surgery and get you in before your surgery so I can see you in person, examine you, make sure the plan is good, and then we'll get you on the books for your surgery. Lele, what if you had the gastric sleeve? Yes, if you've had the gastric sleeve, I've operated on many patients. Actually, a good amount of my patients have had some type of bariatric surgery. So they've had the gastric sleeve or something else, and they lose a ton of weight, 100 plus pounds. They've got a lot of loose skin. They come in, and I go ahead and fix that loose skin. I remove that loose skin. I do body lifts, thigh lifts, arm lifts, breast augmentation procedures, the drainage tummy tuck, the Mons pubis lift. So all of those procedures really help to make them feel much more comfortable in their own body, and they're able to find appropriate clothing and actually be able to engage in activities that they couldn't before. Not to mention the confidence level is boosted, the hygiene is better. They don't have those body odors in the groin area, in the pannus area. They don't have sores anymore. They don't have those rashes and things like that. All of that really, really makes a huge difference. So definitely we'll be happy to take care of you if you've had a gastric sleeve. Text us, call us. We'll be happy to take care of you. Annalise Bernas Zero. Do you recommend massages for the tummy tuck? For my technique, when I do the drainage tummy tuck, you have very minimal swelling. I do not require lymphatic drainage treatments. If you want to have them done, you can. It's not going to hurt, but you're not required. When we add liposuction to it, like a lipo 360, then yes, I will require that you get your massages. Thank you for joining us. Go ahead and ask your questions. Don't be shy. I can't speak for the other surgeons, but my technique with the drainage tummy tuck, you do not need lymphatic drainage treatments. Laura is asking, can a consultation be done through Zoom? So we don't do it through Zoom. We do it through our electronic medical record system that is HIPAA compliant. Essentially, it's pretty much the same as if you're doing Zoom or FaceTime or WhatsApp or stuff like that, but it's actually medical and HIPAA compliant. So you'll get a link. We'll be able to do a teleconference and take care of you through that. Yes, absolutely. And I do quite a few teleconsultations with my patients because a lot of them are from out of Houston, the Houston area. They're coming from Dallas, Austin, San Antonio, Corpus Christi, coming from El Paso. A lot of people will come in from also not just Texas, but they'll come from neighboring states all over the U.S. And then a few will come in from Canada and Mexico. So I know I've got some people who are from the islands and also across the ocean in Europe and Africa who are wanting to come in. So eventually we'll be able to get those cases in as well once they're able to make it out here. Nadar Bashir, what is the downtime? Okay, so for the drainage tummy tuck, it's very quick recovery. My patients typically will wean off their pain meds within 3 to 5 days. During that time, they're walking upright. They're not walking hunched over for like 3 weeks, like the traditional technique with the drains. They're walking upright within 3 to 5 days. They typically will be off their pain meds, driving themselves in to see me at their first follow-up 1 week after surgery, and then they go back to work. They can start back to work usually at 7 to 10 days. If not, you can take 2 weeks and you can start at 2 weeks. Usually at that point, you're going back to the gym. You're doing light aerobic activity. So you're walking. By the time you get to 4 weeks, you're probably getting to a much brisker pace and incorporating maybe the elliptical machine and things like that. At 6 weeks, you can start light resistance training in the gym. And then at 8 weeks to 2 months out, no restrictions, full lifting as your body is able. So it's a very, very quick recovery with the techniques that I do. Thank you for your question. User Princess 4200. I just want a tummy tuck. Absolutely. We'll be happy to take care of you. This patient here, she had just the drainless tummy tuck. She didn't have liposuction. She didn't have fat transfer, nothing done to her breast. She'll probably come back later on to get other things done that she would like to get done. But for her surgery, it was just a drainless tummy tuck. And you can see what a huge difference we made and achieved for her. You can see these beads that she wears around her waist. They're stuck on the upper part of her belly. These are the same beads now all the way down her waistline by her bikini line after the tummy tuck. All of this is completely gone. We brought her belly in nicely, did the repair of the separation muscles, lifted her mons pubis area. It is nice and flat and beautiful. She is absolutely thrilled. So if you want just tummy tuck, we will be happy to do that for you. I actually have 2 tummy tucks coming up on Friday. That's all they wanted as well, just a tummy tuck. So I was able to put them back to back. They usually take about 2 to 3 hours each surgery. So it's about 6 hours of surgery for me in a day. Very easy day. And I'm looking forward to it for their transformation. It's going to be amazing and wonderful. So please go ahead and put this number on your phone. This is our office number. You can call us or text us anytime. We will respond, of course, during business hours. You can also put in your information in the form on the bottom left of the screen there. There should be a form. Put in your name and the procedures you're interested in, and we'll be happy to take care of you. Emily, again, how to make an appointment? Call us or text us at this number. or put in your information in the bottom left of the screen. Very simple. There should be a form there. It's on TikTok. We'll reach out to you throughout the week and make sure that we get you in for your consultation and get you on the books for your surgery. User Princess 4200. How long do I need to be there for tummy tuck to stay? So if you're coming in from out of town, if you're flying in, say for example, I'll give you a scenario. I have plenty of patients that come in from Florida, East Coast to have these surgeries. You'll fly in, you'll stay about 5 to 7 days. So about 1 week, get your first post-op appointment and then fly back up. If you're within, say, driving distance, say, for example, you're about 3 or 4 hours away from Houston, you usually just stay overnight and then drive back the next day. Some patients will actually be able to just go home. Like if you're within a 2-hour radius, distance-wise from Houston, same day you can go home within a 2-hour radius. Usually, if it's longer than that, you'll stay at least overnight, you recover well, and then the next day you're back. You can hit the road or fly, not fly. You'll stay, because if you're flying, you're pretty far out. Flying, you'll stay in for about a week. But if you're within, like I said, that 2 to 3 hour mark, you can stay overnight and then drive over there back home the day after. But definitely contact us. We'll be able to discuss it in greater detail. Everybody's situation is different and unique, and so we definitely make sure that we tailor it to you and make it as easy as possible for your recovery. Of course, safety is my #1 priority. I want to make sure that you're safe. You go through these procedures safely, and then you have beautiful results, and you can enjoy them. Kenny is asking, how long after a tummy tuck can I go back to get a muscle repair if I didn't get one? I would wait about probably 9 months to a year, because you want to make sure that all that tissue heals well, this scarring sets and everything, and then we can go back in and do that. So that's what I would counsel you to wait about 9 months to a year, and then we'll be able to go back in and fix everything. Okay, girl interrupted. 13 or 30? 13. 1 3. 1 3 thousand. So 13,000. 1 3 is what I charge on average for my drainage tummy tuck technique. I've had, like I said, when I kind of like discuss it with other patients who've had other consultations with other surgeons, they'll quote me $18,000 and $20,000 for the traditional tummy tuck. So I think this is a huge bargain, that you're getting such a wonderful technique at a much lower price than what other surgeons will otherwise charge, with you being hunched over for 2 to 3 weeks, having drains in and having to deal with that. Mine is completely drainless, beautiful technique. And all you have to do is pretty much focus on eating, getting back to your normal daily activities, showering, getting back to work, and things like that. So you don't have to worry about any of that other medical drains pulling on you, tugging on you, falling out, and making it very difficult for you to recover. How long is your procedure? So for the tummy tuck, it's usually around 2 to 3 hours. It's the same day. So you all typically will leave the facility the same day. So for example, if you come in at 7 a.m., we have surgery at 7 a.m. You come in at 6 a.m. The nurses will get you ready. We'll go into the room usually around 7, start cutting, anesthesia, all that stuff. It takes about 20 minutes to, say, about half an hour. You're completely asleep, comfortable. I start the procedure usually around 7:30. We'll probably be done around 10 a.m., 10:30-ish. You wake up, you recover. Usually by noon, you're out the door. So for your spouse or your friend or whoever is taking care of you, your caregiver, they'll drop you off at 6 a.m. They'll come back and pick you up around noon. That's typically how it is. And I will call all of my patients after surgery. So you will get a personal call from me a couple hours after your surgery to make sure that you're doing well. And I will answer any questions that you might have and make sure that your pain is well controlled. And you will have direct access for any emergencies to me. You can text me or call me. That's one of the benefits of having surgery with us at Deigni Plastic Surgery. T. Marie Nurse Babe. How long after birth? So after birth, typically, depending on what you want to have done, say, for example, you want to have a mommy makeover, you're going to get a tummy tuck, but also breast work. We typically will tell anybody who's breastfeeding to wait at least 3 to 6 months once they're done breastfeeding, because the breast will change. And once the breasts have stopped changing and they're stabilized, then we can move forward with the surgery. If you're not wanting to have breast work done and you've given birth, I would wait about 9 months. I'll give your body about 9 months to really get back to its stable state before we move forward with the surgery. What do I need to stop before surgery? Is caffeine okay? I think caffeine should be okay. You definitely want to stop anything that's going to increase your bleeding. So a lot of supplements that people take over the counter have some kind of element that will increase bleeding. Anything that will increase blood clots as well. So hormone replacement therapies and things like that, we'll have to stop those probably 3 to 4 weeks before surgery. And then you can resume them usually about a month after. Other things like, for example, the GLP-1 medications, so Ozempic, tirzepatide, things like that, you'll have to stop those. Definitely have to stop smoking. But I think caffeine should be fine. But you just won't be able to drink the day of surgery. So you have to stop usually the night before, usually nothing to eat or drink after 6 p.m. Sonia, how is it drainless? Oh, okay. So the drainless technique, it's the way I do it. So I put meticulous stitching all around the belly area. So typically this whole area in the traditional technique is opened and you put drains in there because it's going to fill up with fluids and drains. And it needs to drain. Otherwise, you're going to have a big belly and it's going to be a seroma fluid collection. You have to get that removed. But my technique, I go ahead and actually put stitches. I put individual stitches all the way around there, and it really placates everything and puts everything back together so that you start healing immediately. The traditional way, this is open. You've got fluid and things move microscopically, but it's still moving. And it takes about 2 to 3 weeks for that fluid to go away and for your tissues to heal, to meet and start healing. I bypass that system, put everything down, so very minimal fluid will actually accumulate. Your body's naturally able to absorb that and process it through your kidneys, and you urinate it, and minimal swelling, and you heal much faster. That's the technique that I use. What is the downtime for the tummy tuck? So like I said earlier on, it's very quick, usually 1 to 2 weeks, and you're back at work. You will most likely wean off your pain meds. The majority of my patients wean off their pain meds within 3 to 5 days. During that time, they're walking upright. By the time they come to see me 1 week after surgery, they're typically walking upright, driving themselves to the appointment. They're off their pain meds and feeling much better. And then after that, usually they're clear to go back to work if they haven't started working already. Usually at 2 weeks, you'll be increasing your aerobic activity. By 3 to 4 weeks, you're in the gym doing maybe some treadmill workouts, elliptical workouts. By 2 months, you're in a gym doing full body workouts. Shay is asking, can you do a tummy tuck after lipo? Denise H0625, thank you for joining us. Go ahead and ask your questions. Don't be shy. We'll be happy to answer them, or just listen. We're talking about some very interesting topics here. So can you do a tummy tuck after liposuction? Yes, you can. I've operated on patients who've had previous liposuction and wanted to get a tummy tuck, and I've done it. The thing is, with the liposuction, you have a lot of scar tissue, so it makes things a little bit harder, tedious, but I just take my time and very careful, dissecting appropriately, moving things, and giving them a nice results. Thank you very much, Lisa. I appreciate that. So definitely, if you would like to have a tummy tuck, you've had previous liposuction, come in and see us. Put in your information in the bottom left of the screen there. There should be a form, or an easy thing too is just put this number on your phone, text us or call us anytime, and we will respond during business hours and guide you through the process. Let's see. So Jasmine is asking, how much does this cost versus a traditional tummy tuck? Very good question. I was just answering that. It depends on the surgeons. It depends on the techniques. It depends on the region. Right now, my drainless tummy tuck is actually even cheaper than some of the tummy tucks that I've heard patients say they've got quotes for, and they don't even use the drainless technique. So I've had some patients come and tell me that they've paid $18,000 for a tummy tuck. Some others have commented even on TikTok that they paid $20,000, and these are with tubes. They don't even use the drainage technique that I use. So I'm provide a lot more value at a much less price. My drainage tummy tuck on average is $13,000. So that goes to show that I probably should be increasing my prices. So come in and get your surgeries done now before we start increasing those prices. Because if they're doing the traditional tummy tuck at $18,000 and I'm making so much improvements in the techniques and making your recovery a lot smoother, the prices will most likely go up later on. So definitely come in and see us. We'll be happy to take care of you. Right now, take advantage of the pricing. It's $13,000, and that takes care of, like I said, all your post-op appointments, anesthesia facility, and surgeon's fees. Walk by faith. How much for a full tummy tuck, drainless tummy tuck? So it's on average for me, it's $13,000. That's what I will charge for my patients. So definitely contact us. We'll be happy to take care of you. Put in your information in the bottom left of the screen there, or contact us. This is our phone number right here, 281-724-3138. You can call us or text us anytime. If you're wanting to contact us after hours, I would say just text us, and we'll be able to respond the next day or the next couple of days during business hours, or leave us a message even if you call. Not a problem. Chris Babe 77, does a patient need to have a certain BMI? Yes, we want the max BMI for these procedures to be 35. Ideally, we would like you to get to maybe like a 28, 30, or 32 BMI. Around that range will be good. So max BMI 35, otherwise ideally 32 and less. We would prefer you to have that. So what does that equate to? So for example, if you're 5 foot tall, a max BMI will be achieved if you are at 179 pounds. If you're higher than that, you need to lose weight. If you're 5'2", 191 is your max weight. If you're 5'4", 204 pounds. If you're 5'6", 216 pounds. If you're 5'8", 228. And if you're 5'10", it's 240 pounds. Now that's the max BMI. We definitely would prefer you to have much less. So get more to like the 32, 30, or the 28 BMI for your benefit. Hey, Linda, how you doing? Nice to see you. Hi. Okay, Faye, do you do the arm lifts? Are black skin risk for kilos? Yes, I do arm lifts. I've done arm lifts on many patients, and I really enjoy being able to provide that surgery for my patients. I haven't had anybody develop any keloids from these procedures. The arm lift and the thigh lift surgeries tend to have a little bit more wider incisions or scars when they heal, just by the nature of the extremities. That's all. Otherwise, no keloids. So we'll be happy to take care of you. Put in your information in the bottom left of the screen there. There should be a form, or just put this number in your phone. Text us or call us anytime and let us know what procedures you're interested in. My patient coordinator will be happy to reach out to you and get you in for your consultation. Val, how much is Lipo360? I don't know the pricing of all of these procedures. The only one I know about is the drainage tummy tuck, because that's my signature procedure. So definitely call us, and we'll be able to give you a quote for that. Or not a quote, but like at least an estimate. Any patient that comes in and gets their consultation, either virtually or in person, gets a quote. And that's what you can expect to pay for your specific procedure for your surgery. So contact us. We'll be happy to take care of you. This is the phone number, 281-724-3138. And text us or call us. Do you recommend massage therapists? How do I get on that list inquiring from Corpus Christi? Andrea Nunez. Okay, so good. So for our patients who are from out of town, If you're planning on staying for some time in Houston, we definitely will refer you to the massage therapist that we use for all of our patients and do a phenomenal job. Our patients love it and it's amazing. If you're in Corpus Christi, then we'll probably have to see if you have anybody that you can find there. Otherwise, like I said, if you're coming and you're planning on staying in the Houston area for a little bit, I mean, Corpus Christi is 3 hours away. You can always drive in for that. Bit much, but especially more if you can't find anybody in Corpus Christi. But I'm sure there should be some massage therapists there. Otherwise, we do have some that we recommend for all our post-op patients who've had liposuction with us. How much is the mommy makeover? Very good question, Bushra. Mommy makeover can be anywhere between $20,000 and $30,000 or $35,000. I've had patients who've had quotes about $34,000, $35,000, depending on all the procedures that they put in. It all depends on what you want to have done. So we tailor it to your needs. I've had some patients who've wanted almost everything done. Skin tightening, skin excision procedures, liposuction, fat transfer, tummy tuck, breast work. So the full transformation. That's more on the higher end, usually around $32,000 to $35,000. But we also have some other patients who have not as many procedures, and it will be usually around $20,000 or so for their mommy makeover. So depends on what you want to have done. Definitely contact us. We will be happy to take care of you and get you some estimates, and you'll get a quote when you get your consultation with us. Sadi Abdullah is saying, how much is a tummy tuck? Just joined. Yes, $13,000 on average is what I charge for my drainless tummy tuck technique. And I've been told that it's a very fair price, less than what some have paid for their traditional tummy tuck with drains. I've heard quotes of $18,000 and $20,000, sometimes even a little bit more than $20,000 for patients who've had surgeries, tummy tucks with drains. I do the drainage technique. It's much easier recovery for you, a much smoother recovery, and it is very affordable. The $13,000 includes anesthesia fee, facility fee, surgeon's fees, your garments, your scar cream, your post-op appointments. All inclusive. Faye, do you have pictures of? Yes, I do. If they're not on my website, I'll have to make sure that we post them. But I do have them also on TikTok. So please go ahead and check on TikTok. You'll see them, and I also have them on Instagram. It's the same handle, Deigni Plastic Surgery. So definitely browse through our contact. There should be some playlists or some, yes, I think they're called playlists. Go on body contouring after massive weight loss, after MWL. Click on that. You'll see thigh lift, arm lift, body lift, all these procedures that I do for patients who have had massive weight loss. And you should see the arm lift surgery. Zakia Morowa 7. What is the best weight for Lipo 360? It all depends on your height. So ideally for a BMI for Lipo 360, depending on what your goals are, a BMI of 28 probably would be ideal. Bigger BMIs, it's a little harder to maintain those results longer term. We definitely need to get you to have some type of lifestyle change, but max BMI for these procedures would be 35. But ideally, I would say your BMI of 28 would be ideal. Just Carter, hi, I'm interested. Wonderful. This is our phone number. Put it in your phone. Text us or call us anytime. We'll respond during business hours, of course. But also put in your information in the bottom left of the screen there. We'll be happy to have you come in and get your consultation, and also get you on the books for surgery. Let's do another goal. Heart puffs of 10. If you guys are finding this content interesting and valuable, please go ahead and send us a heart puff gift. All right. How do I get a consult? Very easily. This is our phone number. Put it in your phone. Text us or call us your name and information, and we will reach out to you. If you're calling us, call us during business hours and we'll be able to get you on the books. Or you can also put your information in the bottom left of the screen there. There should be thank you very much, Tropical Exotic Treats. I appreciate it. You're always gifting us. Putting your information in the bottom left of the screen there, and we will reach out to you to get information from you and take care of you and get you on the books. Koki, I'm looking for chin lipo. Yes, we do. We provide chin lipo. We'll be happy to take care of you. So put in your information in the bottom left of the screen there. There should be a form. Or contact us at this phone number, text us or call us anytime, and we'll reach out to you as well. If it's after hours, we'll be able to reach out to you usually the next business day during business hours. Devana Collins, do you have a payment plan for a tummy tuck? Yes, we do. So we have financing options. We offer Care Credit, Alpheon, Patient Fi, and Cherry financing. And our patients will take advantage of those as well for their payments. Hey, Tori Carmen, thank you very much for joining us. I appreciate it. I hope your evening is going well. Join my fan club. There you go. What's the cost of the arm lift, Faye? I don't have those prices with me, but definitely contact us. My patient coordinator will be able to give you some estimates as to what the you can kind of think what you need a budget. But the pricing will be determined once we see you, because I need to know what you're presenting with and what I need to see what the surgery is going to be like, and so that will determine how much time, and the pricing also goes by the time. Yeah. Marilyn Boricua, I need this in my life. We'll be happy to take care of you. This is our phone number, 281-724-3138. Definitely put it in your phone. Text us, call us anytime. We'll reach out to you. If it's after business hours, we'll get you usually within the next couple of business days. And also put in your information in the bottom left of the screen there. There should be a form, and we'll be happy to guide you through the process and get you on the books. We've got some openings, definitely. I know summertime can get busy. You guys are probably interested in having stuff done, especially those who are have kids out now and they can actually they're out of school, on vacation, and things like that. You can come in for your surgeries. Definitely contact us now. It's May, so we can book you for June and July and get all of that taken care of you before school starts back again in August. You only live once. I have diabetes, high cholesterol, high blood pressure. Can I still get a tummy tuck? Yes, I've operated on patients who have those conditions as long as they're controlled. So we need to make sure that your hemoglobin A1C is less than 7, your high blood pressure is well controlled, and then we'll have to check your cholesterol levels as well. But as long as all of that is medically under control, we should be able to move forward with you getting a tummy tuck, and we'll be happy to take care of you. Putting your information in the bottom left of the screen there should be a form, and we will be in touch. Joe, how much for the fleur-de-lis? Again, I don't have the pricing for that. You'll have to contact us. We'll have to see what exactly needs to be done. Again, like I said, the reason there are prices that vary excuse me, is because some patients may have a lot more skin, a lot more scar. They may have had some different surgeries before, and it's going to take longer. That timing is important because anesthesia and facility charge by time. So I have to be able to estimate as accurately as possible how much time we think that surgery is going to take. And that's why there's variations in the in these pricings. So when I see you and I'm able to examine you either through virtual consultation, because you will send us pictures, I can have a better idea of how much time will be required for that particular surgery, and then we can kind of give you an estimate for the or a quote for the surgery process then. Okay, so Carolyn Butler, 6507 is asking, what's the difference between a paniculectomy and a tummy tuck? So the paniculectomy is, for example, if I did a paniculectomy in this patient, you'll still have the hip-to-hip scar, but the only thing I would be removing is the lower part of the belly here, and then I would be including, I always do that. I don't think other doctors necessarily would do it, but I always do a monsplasty, so I'd fix the mons pubis area as well. So I do those two always in my procedures. The full tummy tuck gives you a nice flat belly like this. The paniculectomy will not give you that. You would still have that bulging up top. This is your belly button. So anything above this area will not be treated. You won't get the separation of muscles fixed with a paniculectomy. The paniculectomy literally just removes the overhanging pannus, which is that tissue overhang over your mons pubis area, your fupa area, and over your hips. That's the difference. The tummy tuck is much more inclusive, takes care of all of those areas, and gives you this type of result. You would never get this with a paniculectomy only. If I've missed your question, please go ahead and repost it, because I know sometimes TikTok just refreshes things, especially when there's a lot of questions. So I definitely want to be able to answer as many questions as possible. I know we've gone over an hour. I usually do an hour. I'll give you guys probably do a couple more questions and we'll wrap it up. I really appreciate you guys participating, and I appreciate you guys taking the time to ask your questions. Ro, so you don't do the muscle repair with the tummy tuck? No, I always do muscle repair with the tummy tuck. The muscle repair is always part of my drainless tummy tuck technique. For paniculectomy, you don't get your muscles repaired because the paniculectomy only addresses the bottom part. It doesn't fix the whole thing. The tummy tuck that I do, the drainless tummy tuck, fixes everything from the top part of your belly all the way down to the mons pubis area. So always do the muscle repair. I always include the muscle repair when I do the tummy tuck, and I give you a bonus because I do your mons and your fupa area as well. Michelle Dansby is asking how much for the tummy tuck. The drainless tummy tuck for now is on average $13,000. Linda Marie 83 is asking, do you have payment plans? We do offer financing options, cherry financing, patient thigh, care credit, and Alpheon. Miss Oni, tummy tuck with muscle repair? Yes, I always include the muscle repair for my patients when I do the drainless tummy tuck technique. What's the price? I answer that. Michelle Dansby is asking, do you accept health insurance? No, we do not. We do these procedures and all our patients pay out of pockets. They use financing, or they'll pay through cash or money order or credit card, debit card. We do not take insurance, and insurance does not cover these elective procedures that we perform. Jessica's saying, hi, sorry, I just got here. Do you do muscle repair with tummy tuck? Yes, absolutely. I always do the muscle repair for all my patients when I do their drainless tummy tuck. And I do the drainless tummy tuck, so it makes your recovery a lot easier and a lot smoother. Trisha is asking, do insurance pay for it? No, they do not. You're very welcome, Linda's Psychic Sessions. I appreciate you guys participating. These procedures are known as elective procedures, and so insurance is extremely rare that you'll have an insurance that will pay for a tummy tuck. I don't think anybody pays for it. They may pay for the paniculectomy part, which is just addressing the bottom part here. They don't pay for the separation muscle repair, the transposition of the belly button, fixing all this area to give you a nice flat belly and mons pubis area. Insurance does not cover that. That's all out of pocket. K Smith 8992 on Instagram saying, need a skin lift, a skin draft of left thigh. Can this be done during the tummy tuck with the skin removed? So I'm not sure what exactly that procedure is on the left thigh. You need something done. I'm not sure what a skin draft is. Maybe it's a typo. Let me know. Otherwise, it sounds like we could probably take care of that procedure while we do the tummy tuck. So contact us. Our phone number is 281-724-3138, and we will be happy to get you on the books for your consultation. I'll be able to examine you from a burn. Oh, okay, like a skin graft. Okay. So you need a skin graft of the left thigh from a burn. I see. That's a good question. It can be done at the same time, but typically skin grafting from a burn, all of that is covered by insurance. I don't take insurance, so I wouldn't recommend doing it at the same time. I would recommend getting you covered by insurance to get that taken care of. But the drainless tummy tuck, I would be happy to do that for you, but you'll have to pay out of pocket. It won't be covered by insurance either way. But good question. Okay. contact us. We'll be happy to take care of you. Okay. Okay. Last questions here. You're back. Yes. Tropical exotic treats. Thank you. Winnie is asking, do you have any specific rules that patients should follow before surgery? Definitely make sure that you're in a good health routine, work-wise, workout-wise, health, lifestyle. If you smoke, you need to quit smoking. And stop any kind of medications that would increase blood clots or increase bleeding. A lot of supplements that patients will take will fall into that category, so we want you to stop those. And other things that we will definitely discuss in detail specific to you. So when we get your medical history, we'll be able to discuss that in greater detail. Linda, psychic sessions, will I be able to do a tummy tuck? I have lupus. Yes, I've operated on patients who have lupus before. We need to make sure that it is under control and that your endocrinologist is clearing you for you having surgery, and we will be happy to do that. All right, I think we're going to be wrapping up here. Ed is asking, can I still attend classes after tummy tuck? Absolutely. Most patients will usually be able to return like in person. Virtually, absolutely you can, but in person, probably if you have to drive yourself, walk and things like that, usually by that second week, you're able to go back to, you'll be able to go back to attending classes. Not a problem. Last question. User Princess 4200. Very good question. Have you ever had any major problems with any of your patients from the tummy tuck? I have not. Drainus. I have had one patient develop bleeding, so a hematoma, which can happen. And for that, what we do is you go back, we open it up, find the source of bleeding, stop it, and then close it up. Otherwise, no. And they healed very well, beautiful results, and no issues at all. Thank God. And we'll keep it that way. Nia, can I be awake during the process? No, not for a full tummy tuck. For a mini tummy tuck, yes, you can be awake, but it depends on whether or not you're a good candidate, because some patients will not be ideal candidates to be awake to have their surgery. So, question by Tropical Exotic Treats, is Lipo 360 better than a tummy tuck as it relates to sculpting the body? It all depends on your body. It all depends on what you present with. In certain areas, in certain circumstances, Lipo 360 would be better. In other circumstances, the tummy tuck will be better. So I can't answer that question bluntly for everybody. It all depends on your specific body and your what you present with. Wonderful. Let's see. Okay, last question for real this time. Loan signing made easy LLC. Would the tummy tuck remove stretch marks? The tummy tuck typically will remove all the stretch marks, as many stretch marks as possible that are below your belly button. Anything above your belly button, it will just remove it, but move it all the way down to where it's barely visible, right by your bikini line. You may have a few stretch marks that stay, but otherwise, yes, we will remove the majority of your stretch marks. Thank you very much, everybody. I appreciate you guys joining us. And remember, I do these live sessions, Q&A sessions for your benefit. I do them every Tuesday and Thursday, usually from 7 p.m. Central Standard Time, usually till 8. Every once in a while, I'll go a little bit higher or longer, depending on questions that we get, and that's wonderful. So, okay, so we got Strawberry Troll saying $15,000 yesterday, had tummy tuck, and you have the drains right now. Yes, so I charge less and I do drainless, so the recovery is much faster, much easier. So maybe I need to revise my pricing and increase it. So you guys definitely take advantage of it right now. We're not planning on increasing the pricing anytime soon, but in the future, I think it definitely will increase. So come in and get your drainless tummy tuck with us, and And we look forward to meeting you and seeing you. Can this help with diastasis recti after 4 large babies and 4 C-sections? Absolutely. I've done that on patients before, and they've done extremely well. All right, guys, I really have to get going. I really appreciate you guys participating. Again, follow us, like us, Deigni Plastic Surgery. Come and see us. We'll be happy to take care of you. And until next time, have a good night, everybody. Thank you so much for your questions. I did not get to everybody's questions tonight. I apologize, but come and hit us up on TikTok on any of the videos. Put your comments, put your questions, and I'll do a video to answer it, or just answer it by texting. But the easiest thing is just call us, contact us. We'll be able to talk, get you in for your consultation, and get you on the books for your surgeries, okay? Thank you. Have a good night. God bless you. And until next time, bye-bye. Thank you very much. K Smith 8992, come and see us. We'll be happy to take care of you, okay? Dieu merci, il y a eu beaucoup de personnes cette fois-ci. Ouais, avec beaucoup